Today is the first class of this head, neck and face region. Okay, today will be the first class of osteology. It will be a small class because after that you will be having a class on histology. Okay, today we will read about 3 vertebrae. These are atypical cervical vertebrae, that is C1, C2 and C7. C1, C2 and C7. Many things are written on the slides, just no need to write it down. If you need to write anything, I will tell you, and I will ask you people to click few pictures. Okay, then you may not understand or the muscles because it has not been covered in theory or dissection. Once you cover the theory and dissection part, then you will be able to correlate everything. Just listen, and when I ask you people to click pictures, then take pictures. Okay, there will be very few points that I will tell you people to write, note it down. Okay, we'll start with the C1 vertebrae. C1 vertebra. C1 is also known as you know what is it called? It is also known as atlas. Why so? Why is it called atlas? Why is it called atlas? Atlas कौन था? पता है किसी को? According to Greek mythology, Atlas was Atlas used to carry the globe. Exactly like that, this C1 vertebra carries the globe over head, so skull. That's why it is also known as atlas. The C2 vertebra is also known as axis. Okay, and C7 is also known as Vertebra Prominens because the spinous process is very prominent and long. Okay, I will explain individually, but just giving you a rough idea. This one is your C1 vertebra, that is atlas. Does it have any body? Can you see body in this bone? It doesn't have body. Does it have any spinous process or spine? Does it have any spinous process or spine? No, it doesn't have any spinous process. Okay. There are 2 lateral muscles. 1, 2. Okay. They are fused together in the anterior. This is known as anterior tubercle. Anterior tubercle. And posteriorly this is known as posterior tubercle. Anterior tubercle, posterior tubercle. Okay. And these are what are these things? Transverse process. And these are foramen. Okay. Just look at this picture. What are the parts? See, anteriorly this is anterior tubercle. Posteriorly, posterior tubercle. This is your foramen transversarium. Foramen transversarium. This is facet for dens. Dens of which bone? Dens is part of which bone? Dens is part of C2 vertebra. Okay. This is the facet for dens. This is superiorly present. Obviously, this will be superior articular facet. Inferiorly present, this one. If you look from below, this is the inferior articular facet. Okay, inferior articular facet. This one is superior. And what is this thing? This is vertebral foramen. Vertebral foramen. Okay. Now click a picture of this one. This one is taken from textbook of IBC. If possible, please draw a freehand diagram. Otherwise, just take a picture. Okay. These are transverse process. This is the facet for dens. Facet for dens. See, this is the anterior tubercle. This is your posterior tubercle. Transverse process, foramen transversarium, superior articular facet, inferior articular facet, and this is the facet for dens. What's the shape? You can see this is a ring shape. Consists of right and left lateral muscles connected by a short anterior arch and a long curved posterior arch. Okay. The right and left transverse processes are present. I have shown you. What are the features? Absence of body, absence of spine, and relatively longer transverse processes. Okay. This is the superior articular facet. What's the shape? Concave and elongated. They are kidney shaped. What's the direction? Superior articular facet directed upwards and medially. It articulates with the condyle of the occipital bone. And it forms which joint? Condyle of the occipital bone. नीचे है atlas. Which joint? Atlanto-occipital joint. Atlanto-occipital joint. नीचे कौन सा वाला facet है? Inferior articular facet, right? नीचे कौन सा bone है? Axis. Which joint? Atlanto-axial joint. नीचे होगा atlantoaxial, ऊपर होगा atlanto-occipital. Right? The inferior articular facet are more or less circular. It is directed downwards medially and backward to articulate with the corresponding facet on the axis vertebra to form the atlantoaxial joint. ऊपर होगा atlanto-occipital, नीचे atlanto-axial. The medial surface of the lateral mass is marked by a small roughened tubercle to provide attachment to the transverse ligament. See. Can you see the rough area here? Can you see? Just look at the picture. This rough area. Okay? This rough area. This tubercle, this area gives attachment to which ligament? The medial surface of the lateral mass is marked by a small roughened tubercle to provide attachment to the transverse ligament. Transverse ligament. The transverse process project laterally from the lateral masses. बताए. See, these are the superior articular facet. These are kidney shaped, concave. And these are the inferior articular facet. You can see these are round or circular. Okay? These are the parts. Now, few important attachments and relations. Okay? Everything has been written here. No need to write it down. Just look at the picture. Whatever I describe in this picture, that is exactly those things are written here. See, which ligament is this? I just now, this is the transverse ligament, right? What is this part? What was this part? Which tubercle? Anterior tubercle. This was posterior tubercle. This is transverse process, and this area was, see, groove for the vertebral artery. If it is named as groove for the vertebral artery, what will it have? Obviously, vertebral artery hoga, right? This is the groove for vertebral artery. Now see the attachments. This was transverse ligament, and adjacent to the anterior tubercle, which muscle is present? You can see the fibers of longus colli. Take a picture. Adjacent to the anterior tubercle. Now look at the posterior tubercle. There are two important attachments. What are those? Read with me. What are these two? First one is ligamentum nuchae, and then rectus capitis posterior minor. Right? This was the groove for vertebral artery. Then it will have, what is this? Obviously the vertebral artery, and beneath the vertebral artery there is this nerve. See. The first cervical nerve crosses the posterior arch deep to the vertebral artery and divides here into the anterior and posterior primary rami. See, this is the anterior primary rami, and this one is posterior primary rami. Right? Now adjacent to the transverse process. See, you have to know the orientation. This is the anterior part, right? This is the posterior part. So from anterior to posteriorly, what are the muscles? What is this? Rectus capitis, anterior most, right? Rectus capitis, anterior. This one is rectus capitis, lateralis. This one is levator scapulae, and then oblique capitis superior. Right? This is exactly what's written here. See, oblique capitis superior. The oblique capitis superior arises from the posterior part of the upper surface of transverse process. This is the upper surface posteriorly present. This is the oblique capitis superior. But the inferior muscle, the inferior capitis, the oblique capitis inferior, and the spinous cervicis, they are inserted into the inferior aspect of the transverse process. इस पिक्चर में नहीं दिखेगा because they are present inferiorly. Okay, oblique capitis superior होगा superiorly और inferior होगा नीचे की तरफ inferiorly. Okay, again revise with me. Anterior, adjacent to the anterior tubercle, which muscle? This is longus colli. These two are rectus capitis posterior minor and ligamentum nuchae. And these four are rectus capitis anterior, rectus capitis lateralis, levator scapulae, and oblique capitis superior. Right? This is the vertebral artery and the nerve. Divides into anterior primary ramus and posterior primary ramus. ठीक है? And this one was the transverse ligaments. Done? Done? Again, what are the parts? Just this is the anterior tubercle, this is posterior tubercle, transverse process, foramen, transversarium. This is the superior articular facet, inferior articular facet. It has no body, no spine. Right? Done. Now the C2 vertebra. C2 vertebra. C2 vertebra is also known as axis. What's the unique feature? It is having odontoid process. This is your C2 vertebra. This is your C2 vertebra known as axis. This one is unique. This is known as odontoid process. This is the dense or odontoid process. And look at the spine. Can you see the tip is divided into two, right? दिख रहा है ना ऐसा? The tip portion, that is bifid spine, and it is massive and stronger. Okay? And other parts are, see. Take a picture of this one. What is this thing? This is your odontoid process or dense. बाकी सब almost same ही है. See, this is the, what are these two things? These are transverse process, and the foramen is foramen transversarium. ठीक है? Superiorly present, the facet is superior articular facet. This one is spine. This one is your spine. Spine. Superior articular facet, foramen transversarium, transverse process, and this is your spine. What is this portion? Look at the picture and tell me. What are these portions? Lamina. Lamina. Okay? And these two are pedicle. 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 Okay? In case of there is a fracture here. Here. This is commonly seen in judicial hanging. Judicial hanging. Okay? In case of a judicial hanging, we get to see fracture of this pedicle area. This is also known as hangman's fracture. Hangman's fracture because it is commonly seen in judicial hanging. What is judicial hanging? फांसी मतलब कहाँ पर होता है? वो कैपिटल पनिशमेंट जब दिया जाता है उसमें. This is also known as hangman's fracture. Hangman's fracture. Okay. See the features. Presence of odontoid process. Transverse processes are small and lack the anterior tubercle. Anterior margin of the inferior surface of the body projects downward to a considerable extent. Foramen transversarium is directed superior-laterally. Foramen transversarium is directed superior-laterally. And the typical vertebra में होगा, it is directed vertically. Okay. Inferior surface presents a deep and wider inferior vertebral notch placed in the front of the inferior articular process. The superior vertebral notch is shallow and present behind the superior articular process. These are factual things only. Okay. The spine is, I have shown it to you. The spine is massive, that is large, thick and very strong. Deeply grooved inferiorly, also known as, it is steep is bifid. दिखा है ना? दिखता है ना? Like steep is bifid. Okay. The lamina are thick and strong. Lamina are thick and strong. These are facts only, nothing to explain here. Okay. Again, the parts I am revising with you. What is this thing? This is the dens. These are the transverse process. These are transverse foramen transversarium. This is the lamina. This area is the pedicle. This is the spine. And this is the body. Okay. This is the body. Again, the detachments. Just look at the picture. Take a picture of this one. And everything is written there. Two important ligaments attached to the dens. First one is apical ligament. And there are two alar ligaments, right and left. Right and left alar ligaments. Apical ligament and right and left alar ligaments. This was the, which area is this? Which area is this? Transverse process. The adjacent to the transverse process, what are the structures? Levator scapulae and spinous cervicis. Okay. Now, adjacent to the spine, what are the structures? This one is ligamentum nuchae, and then this one is obliquus capitis inferior. Obliquus capitis inferior, and this one is rectus capitis posterior major. Rectus capitis posterior major. And this, if this is the body, the posterior, in the posterior aspect of the body, what is this structure? This is also known as membrana tectoria. Membrana tectoria. Where is it present? In the body. Membrana tectoria. There are few other structures as well, not seen in this picture. Write it down. These three you have to write. These are not seen in the picture. I couldn't get any better picture, so write it down. The vertical part of the longus colli. This is not seen in the picture. It is attached to the anterior aspect of the body. Vertical part of the longus colli. This is present in the anterior aspect of the body. Anterior aspect of the body. The scalenus medius arises from the anterior aspect of the scalenus medius arises from the anterior aspect of the transverse process. And other muscles attached to spine are multifidus, spinalis cervicis and interspinalis. Multifidus, interspinalis and spinalis cervicis. These muscles are not shown in that picture. Multifidus, spinalis cervicis and interspinalis. Now this muscle, what was this area? This area is known as lamina. Lamina पे कौन सा मसल है? Semispinalis cervicis. Semispinalis cervicis. Okay, done. Now the last one, known as C7. Okay, C7 is also known as Vertebra Prominens. It is having a prominent spinous process. Spine is bigger, relatively bigger. Okay, see what are the parts? This is the spine, right? And this is the superior articular facet. Superior articular facet. And this is the foramen transversarium. साथ में transverse process and posteriorly this is present. Posterior tubercle. Posteriorly, posterior tubercle. See, this is the C7 vertebra. This is the C7 vertebra. You can see, right? The spine is relatively longer. This is the spine. What is this thing? These two are superiorly present. That is superior articular facet. This is the transverse process. And this is the posterior tubercle. Posterior tubercle. Transverse process and posterior tubercle. And what is the foramen? Foramen transversarium. सब में same ही है. ठीक है? Foramen transversarium. The spine is strong, long, but not bifid. Unlike the C2. C2 में spine कैसा था? The tip was bifid only. Okay? Transverse process is relatively long. The foramen transversarium is relatively small and it doesn't pass the vertebral artery. It only transmits the accessory vertebral vein. ये foramen से vertebral artery नहीं जाता है. Only the accessory vertebral vein passes through it. Only the accessory vertebral vein passes through it. ठीक है? Now the clinical part I have already told you about the hangman's fracture. There is something known as occipitalization of atlas. Atlas कौन सा है? C1. इसको ऊपर कौन सा बोन है? Occipit है, right? Occiput है. तो occipitalization of atlas is a congenital deformity. Is a congenital deformity. क्या होता है? See, the ring of the atlas vertebra fuses with the base of the occiput. It is one of the most common abnormality of upper cervical vertebra. दोनों fuse हो जाता है. Okay, this is known as occipitalization of atlas vertebra. ठीक है? So done.